Hantaviruses are a group of viruses carried by rodents that can cause severe disease in humans. People are usually infected through contact with infected rodents or their urine, droppings, or saliva. The species of hantavirus involved in this case is the Andes virus, which is found in Latin America and is the only species known to be capable of limited transmission between humans. In previous outbreaks of Andes virus, transmission between people has been associated with close and prolonged contact, particularly among household members, intimate partners, and people providing medical care. That appears to be the case in the current situation. The first case was in a man who developed symptoms on the 6th of April and died on the ship on the 11th of April. No samples were taken, and because his symptoms were similar to those of other respiratory diseases, hantavirus was not suspected. The man's wife went ashore when the ship docked at the island of St. Helena and was also symptomatic. She deteriorated during a flight to Johannesburg on the 25th of April and died the next day. Samples were taken which were tested at South Africa's National Institute of Communicable Diseases and confirmed as hantavirus. The third death was of a woman on the ship who developed symptoms on the 28th of April and died on the 2nd of May. Another man presented to the ship's doctor on the 24th of April, and he was evacuated on the 25th of April from the island of Ascension to South Africa, where he remains in intensive care. Doctors from Cabo Verde boarded the ship to provide care for the 3 other passengers with symptoms. WHO coordinated their evacuation to the Netherlands for treatment. 2 are in a stable condition in hospital, and 1 is asymptomatic and is now in Germany. The 8th case was in a man who disembarked in St. Helena. Following advice from the ship's operator, he reported himself with symptoms in Zurich, Switzerland, and was confirmed yesterday to be infected with hantavirus.